Hey everyone, so I am now today officially 4 days post-surgery. I am still a little sore, not as tender obviously as the night of surgery, but I'm still a little sore. My throat is still a little hoarse and I still have the bump on my lip. I'm going to assume that stuff is because they had to put breathing tubes down my throat and not doing naughty things in my mouth with another part of their bodies. Kidding. So, I'm all about accountability, because, as you guys know. And I still, even though Dr. Russo is a godsend and is a lifesaver and got this done inside of 3 weeks when it was taking, well, actually a little bit more than 6 months with Dr. Yang. So it's time now that Dr. Yang, the people at the Spine and Pain Institute of New York, as well as the Richmond ambulatory services, has to be held accountable for the way I was treated. And I hope you guys like this video, and I really hope you guys share it out and put, the Spine and Pain Institute of New York, Dr. Ajax Yang, and the Richmond Pain Management ASC, all at 1360 Highland Boulevard in Staten Island, on blast. Let them know that they can't get away with treating people like crap. And honestly, if they did it to me, I'm not special. There's no way on this planet, the way I was treated, I'm the only one that got treated like that. They have to be doing this to other people. So let me get into a quicker version what happened. Injured my back 3 years ago. Things were going good with, the Spine and Pain Institute of New York. Dr. Yang did my epidurals. He did multiple RFA ablations on me. No problem. Then lumbar spine gets really, really bad. Another MRI shows major modic changes in my end plates, which means I needed something called the Intracept Procedure. It's something you guys can look up. Carson Daly had it. I just needed a more aggressive version because I had a bigger issue than just what he had. Anyways, moving it along. Dr. Yang sent out the approval to United Healthcare. And look, United Healthcare is getting a beating right now. People hating on them. My representative, my member rep from United Healthcare, Ashley, she is a pit bull. She is a warrior. She is a shark. She did nothing but stand up and fight for me. And I am forever, ever in her debt. And I am grateful to have somebody like her representing me. So here's what happens. It gets approved. Try to get a date to have this procedure done. And then things go sideways at Richmond Pain Management ASC. They don't return phone calls that I make. They don't return phone calls from my United Healthcare rep, Ashley. Now look, you don't want to return calls for a patient of yours. That's messed up as it is. You're not going to call back an insurance company calling you? In what world is that acceptable? So, I decide to start coming down here. Those of you who know me know I don't let things go. I am a shark. I get to the bottom of things. And when it comes to my health, I have to fight for my rights. So I come down here and I speak to the manager of Richmond Pain Management ASC, 1360 Highland Boulevard in Staten Island, New York. And she tells me that anesthesiology is not being covered by United Healthcare. And I said, wait a second. This was approved. They don't pick and choose what things get covered. When something is covered for surgery, things get covered. And I showed her the approval notice that she said that I didn't. She didn't think I had an approval notice from United. And you know what? I'm going to show it to you guys now too. Let's pan down. I don't know if you guys can see it clearly. Approval notice goes on to say, well, I'm not sure why it's not coming in clear, but the fact of the matter is this thing was approved, and this is my approval notice. Okay, and by the way, just to show you guys, I'm not allowed on their property. I'm across the street, folks, at CVS parking lot, but there you see their location. The far side, all the way on the left, that's where the ASC center is, and that side is where the doctor's offices are. Anyways, like I said, first she said to me that anesthesiology is not being covered. Then, a week later, she changes it. The equipment for the surgery is not covered. My reply to her was, so United Healthcare is telling you guys that Dr. Yang needs to use Chipotle plastic utensils to do my surgery? A bit of a smart-ass move on my part, yes, but surgery's approved, but equipment's not? Really? So that's the second excuse they came up with. First, she said anesthesiology. Now it's the equipment isn't being covered. Then 3 weeks later, playing phone tag, nobody's getting calls. I'm not getting return calls. My United Healthcare rep Ashley's not getting calls back. I come back down here, and I'm told there was a code missing that Dr. Yang forgot to put on the authorization form. Okay. So I made another appointment to see Dr. Yang. I showed him the C177 code that was supposedly missing off of the approval form. He redid it, resent it, and there was absolutely no notification that it was ever sent to United Healthcare. So now something funky is really going on, because they have no notification that it was sent. And that's the third excuse. Anesthesiology, the equipment, and a code missing. Now, I guess you can say, Cyclone, something's going on. Why don't you just go to a different doctor? The fact of the matter is, especially when you're having your spine cut open, you kind of want to trust somebody. And I trusted Yang because he's good bedside manner. He's a good doctor. But things are just going haywire. So we start to speak to management on Dr. Yang's side. We play phone tag and leave constant messages for managers Susan C. and Melissa. Neither one call me, neither one call United Healthcare. I decide to come back here once again, and I speak to the office manager for Dr. Yang's side of the building, the office, whose name is Isis. She says to me, "Oh my God, I can't believe you're going through this. I am so sorry. I will get to the bottom of this and I will call you within 48 hours. I waited 7 days, did not hear from her. United Healthcare did not hear from her. I came back down here and I wanted to say, hey, you said within 48 hours you were calling me back, and my dear, it's a week. What's going on? I was told that she is busy for the day. So I asked the girl behind the desk, can I just sit and wait for her? When Isis gets, like 5 minutes, let her come talk to me. She said, okay. This girl, does her job, right? She calls me over to the desk like 10, 15 minutes later, and she says, Isis has left for the day. So I said, wait a second. You just told me she was busy in the office, very busy, for the day, and all of a sudden now she's gone for the day. I'm like, what'd she do? Sneak out? You tell her I'm here waiting and she ran out of the building? That's not right. So another manager comes out to see me, and she says, well, give me your number and I will call you back. Everybody now watching this that knows me knows where this is going. So I said to her, you're not going to call me. You know it and I know it. Let's just be honest. You're not calling me. You don't give a damn. And she said, no, I will call you. My reply was, I think I want to sue you guys for every time I cross the Verrazano Bridge and for the gas money that it takes me to go from Canarsie to 1360 Highland Boulevard. And I left. And I left it at that. I walked out of the building. Right over there, out that door back there, into the parking lot, and I came home. That night, I got a phone call from Dr. Yang. Dr. Yang said, hey, did you come by the office today? I was like, yep. I want to know why nobody is calling me, and they keep promising me, and they keep promising that they're going to call United Healthcare, and they're not calling them either. And not only am I getting pissed, but my rep Ashley is getting annoyed about this. And again, Ashley, my rep from United Healthcare, is a shark. I am so grateful to have her. So what happens is, Dr. Yang tells me that I threatened people in the office. And I was befuddled, dumbfounded. I'm like, what? I said I want to sue you people for making me cross the bridge and for gas money. I said I want to know what the hell's going on. That's so threaten. Who in the world did I threaten? And I kind of had an idea where this was going to go and how this was going to play out. He said to me, if I show up again, they will be forced to call NYPD. Gotta love this. All because nobody was calling back. So, like I expected, I got a certified letter in the mail from the Spine and Pain Institute of New York stating, quote unquote, we will no longer be providing you with medical care due to the aberrant behavior, due to the aberrant behavior you portrayed while in our office on multiple occasions. So which is it? Is it just one time or is it multiple times? And if I had aberrant behavior multiple times, why did you allow me to keep coming back? Why wasn't it stopped the first time if it was multiple times? Another lie from the Spine and Pain Institute of New York and the Richmond Pain Management, ASC 1360 Highland Boulevard, Staten Island, New York. And to show you the letter, yeah, I don't know why it's not focusing, but I just read you the sentence. So, lies galore with these guys. Finally had enough. Help of a friend. I was able to find Dr. Russo all the way out on Bayshore, Long Island, which is like 2 hours away from me. But I needed this done. Went to him, explained to him this whole situation. He got the approval in 48 hours. Had the surgery 2 weeks later, which was, as of today, 4 days ago. Again, I'm still a little sore. Still can't, fully bend. I have a follow-up with him in 2 weeks. I'm probably going to do a video post that appointment. And I have an appointment on Thursday of this coming week with my primary who wants to see how things are going. The great Dr. Ira Steinmetz. And I'll be doing a video post that appointment too. But it's all about accountability. Look, the results of the surgery, I think it's a success. Like I said, I'm still a little sore, but where I was pre-surgery to where I am right now is a legion of difference. Most people, from what I remember reading about the Intracept procedure, truly feel any difference a couple of weeks out. So if I'm feeling a little bit better now, maybe a couple weeks out, I'm really feeling better. Knock wood on my head. I just can't believe that the Spine and Pain Institute of New York did this to me. I mean, they led me around for 6 months. This procedure was supposed to be done in October of 2024, and it's done the first week of April 2025. That's not cool. Needs to be accountable. So if you ever, pardon me, if you ever have any spine problems, any pain problems, do not, I beg you, do not go to the Spine and Pain Institute of New York. Go find someone else. do not go to the Richmond Pain Management ASC. Go somewhere else to have things done. And by the way, just for the record, in between me finding Dr. Russo and this, see, I'm getting so frustrated. I was looking for other doctors. Okay, it's not like I was just sitting home twiddling my thumbs. But I just couldn't find any. So before I cough up a lung now, guys, please like the video, share it, drop a comment, question, please subscribe to the channel, because at 200 subscribers, I do a free giveaway. Okay, guys, I'm gonna go now. Get back to Brooklyn. And until my next video, Cyclone saying, peace out, homies.